Hello everyone, it's Instructor Howard, and we are wrapping up week 3 of BC 2011. This video will give a general weekly wrap-up of what we should have covered in week 3 and general ICD-10 coding examples. We will review what you should have covered in your week 3 coding assignment and some cases therein, and then we will also do a little background on ICD-10 coding for the underlying condition. Okay, let's get started. So in week 3, your list of assignments, as usual, you have a keyboarding. You have modules A and B that you should have completed, and as you go through your modules each week and complete them, you're going to become more and more familiar and comfortable with ICD-10 coding in general. ICD-10 or diagnosis coding is one of the easiest coding systems. Your week 3 step-by-step assignment. As you know, this assignment is pulled from your weekly workbook reading chapter. So as you work your workbook cases, you're generally going to be answering these questions. And if you are a little confused at some of the questions and how it should be coded, then remember every other question or case is answered in the back of your workbook so that you can check your work. Don't forget, every week you have an extra credit that's inside of your test folder. These particular extra credit assignments are based on your own experience, how you answer them. They will offer up to 50 points in your final grade, so you want to make sure you always complete your extra credit. You have a regular test based on the guidelines that you are reading in the chapter and some coding scenarios, and then you have your coding test. Remember, every week you will have an outline of your coding test either emailed to you or inside of the student materials folder, where I send you different scaffolds or resources to help with the assignments and the test each week. So please pay attention to those areas. Now let's cover some general coding. So here's a look at our assignment that we completed this week, or we completed in week 3. You guys started with question 21, and that's the question that you basically start with in the workbook when it comes to your coding scenarios. So you have acute renal failure and acute respiratory failure due to sepsis. So when you see something is due to something else, then the rule of thumb is to code first the underlying condition and then code the manifestations. What that means is that if something is due to the other, whatever it's due to is considered the underlying condition. And let me remove content control if that's the case. Okay, so we have sepsis. Give me a second to remove content control here. This is pretty much how you get access to make changes and notes on your assignment. Is you click here at the top, right click, and then remove content control, and that way you'll be able to do the things that I do on your exam, which is highlight. Okay, so sepsis, that's your main term in this scenario, your main term or your first main term. So we have sepsis is general, and then we can also say that sepsis will also be considered severe because it's causing renal failure. And for those of you who are not aware of what renal failure is, it's the kidney loses its ability to filter the blood and cause elimination of toxins from the blood. So sepsis is basically toxemia or blood toxicity, and then the kidneys are affected because the patient's toxicity has caused the kidneys and the respiratory system to fail. So this could be, you're going to have pretty much 2 diagnoses for sepsis: regular sepsis, which is generalized, and severe. So that's how that should have been coded, 2 codes in this area. Then we're going to deal with the renal failure. So any one of these failures could be considered first because they're two major organ systems, but since he, or in this case the physician, probably listed renal failure first, then we can go ahead and code the renal failure. Now remember, you have failure of two different organ systems, so you're going to start in the index with the word failure. And then dealing with renal failure, sometimes it's considered kidney disease or disease of the kidneys, and then it could be certain stages of kidney failure, but it's just acute at this point, because a lot of times when patients have chronic renal failure, it means that the patient's kidneys are permanently damaged. So since it's acute, we're going to see if we can find failure and then the next subterm. Okay, and I always highlight the main terms in red and the subterms I highlight in green, and any additional subterms, which is the type. Since this is acute and not chronic, that's important. So this is how you should have looked this up. Start with sepsis, code for that, two codes pretty much, generalized and severe, because it's causing problems with the other organ systems. Then you have failure, renal, acute, and this is how you should have looked this up in the alpha index. And then once you locate your reference code, remember, cross-reference it to volume 2 to make sure you put the correct amount of digits at the back if applicable, and code to the highest level of specificity. So once you do that, we come back to the alpha index and look for failure, and then we can go either respiration or respiratory. Subterm or subterm green, and the type, which is kind of like the second order of indentation, is, I'm going to highlight that color. So if you guys go through and highlight the different ways that you could search your terms, you pretty much are going to always be on target. Okay, so I'm going to skip through and find another case that seems like it may be a little difficult for you. For example, 23, you have a long sentence here. Patient with known hepatitis B, seen in the clinic complaining of joint pain, loss of appetite, nausea and vomiting, and weakness and fatigue. He is admitted to the hospital for severe dehydration. Now, if you guys watched the first video that just gave you an overview of ICD-10, and I gave you an example of the patient who had a cough and runny nose, and the doctor gave her a final diagnosis of respiratory infection or acute respiratory infection, we did not need to code, or we had omitted coding all of these other complaints simply because these things like pain, loss of appetite, nausea, vomiting, weakness, and fatigue, those things are considered signs and symptoms. Signs and symptoms are generally a sign or symptom of a more severe condition. So this condition here, dehydration, even though he named it severe, you will not locate severe dehydration. So I am actually going to cross this out too. Your main term here is just dehydration, highlight in red. And then once you code the dehydration, you should also code the hepatitis B. It would seem that hepatitis B would be coded first, simply because it's a main or a chronic condition. However, this is not what the provider is treating. The dehydration is causing all of these other problems. So this is the number one reason for all of these problems here. And then hepatitis is a chronic condition or a disease that the patient is going to permanently have in their medical record, but that needs to be coded as well. And I am going to highlight the type as B. So dehydration, first main term, and then once you code that, you should come back and code hepatitis and then search down because there's different types. There's A, B, C, D, and E. So you want to code the type of hepatitis accurately. And you're going to definitely cross-reference this. Okay, so now we're going to skip down to another one that seems a bit complicated. Okay, so this is another 28 is very similar to the one we just completed, or the one we just talked about, 23. 28 has a lot of wording in the scenario as well. As you can see here, initial encounter for a 45-year-old woman receiving her first cycle of chemotherapy for pancreatic cancer is seen in the emergency room for severe nausea and vomiting due to chemotherapy. She is admitted for dehydration. So number 28, we have the main problem that the patient is admitted for. And then you're dealing with like inpatient coding. The rule is to code first, or always code first, the main reason that warrants or causes the admission. So she's admitted for dehydration, and this is a problem that's causing all of these other signs and symptoms. Then we will code that first. Okay, so now let's see what happened with her with chemotherapy. So basically what happened with this patient is that she had gotten her chemotherapy, and dealing with like the table of drugs and chemicals, she has an adverse effect. So this is what this is considered. So dealing with the table of drugs and chemicals, we have poisoning, and then we have the type or the cause of the poisoning, or we have that the patient took the medication as directed, which is what happened with her chemotherapy, and there was an adverse effect. So that's what you would code from in that column for chemotherapy. I'm going to put a note here because this is probably a little difficult. Chemotherapy is considered anti-neoplastic. That's the type of medication that you will look for in the table of drugs and chemicals. And then from there, your column, and I'm going to do / would be adverse effect. And then you would basically be given a reference code, of course, and you cross-reference that code to the tabular list in the back, and then your code will definitely begin with a T, and you want to make sure you code to the highest level of specificity. So you're going to have an X in your code, and you're going to have an A at the end because this is her initial encounter. So when you're dealing with table and drugs and chemicals, or when you're dealing with injuries or external causes of effects, which is what this is, something external entered the body that caused a problem, then you have to code your 7th character, and your 7th character will determine what encounter this is. And for this patient, this is her initial encounter, says it here, first time being seen for this, so that code or that letter at the end of your code is an A. So now we did this, and so we have a 3rd diagnosis because we can't eliminate the fact that the patient has cancer. And so what we do when we're dealing with cancer, we're going to go to the Neoplasm Table. So here's your experience of coding from the table. You go to the Neoplasm Table, and then you're going to locate the body part or the organ system. So we go to Neoplasm, we go to the word pancreas, and then we're going to code it as, you have several columns. You have primary, you have secondary, you have in situ, you have benign, you have uncertain behavior, and you have unspecified. So in this patient's case, because she is receiving chemotherapy and they're not mentioning that this is secondary, we're going to code it from the primary table. So pancreas, and then, or primary column, excuse me for that. And this one is the one I am going to choose to go through as a walkthrough today. So now that you see exactly how we go through and read these scenarios to code them, I'm going to give you an example of how to look these codes up in your alpha index and also your your tabular list. Okay, so to save time, I am using my electronic coding manual. You guys can follow along with me. This manual, even though it's electronic, it is set up exactly the same way as your ICD-10 manual. This side of my screen is the index, and this side over here is my tabular. So this is kind of like the front of your book, and the back here is the back of my book. So since we're dealing with case number 28, we're going to remember the reason for her encounter, or the reason for her hospitalization, is dehydration. Okay, so it's just giving me a general dehydration code. Remember, it tells us that it's severe and all of this other stuff, but the provider didn't say she has hypovolemia. He didn't give her just general volume depletion. He just gave her dehydration. So when I searched here, I'm cross-referencing here. And as you can see, the E86 is the 3-digit category for volume depletion. And then it's telling us here to use additional codes for associated disorders of electrolytes and acid-base balance. He did not say that the patient had any type of electrolyte problem, like she's lacking potassium or calcium or anything like that. So we're just going to pay attention to our excludes notes. She is not a newborn, so we don't have to worry about that. He didn't say she went into shock. So these are all excludes, just telling us that if your patient has these problems here, then you would code these conditions elsewhere. That these conditions does not classify as volume depletion or dehydration. So we're fine with E8 6.0. Okay, so I have added that code, and now I am going to deal with my other problem. And we have that the patient has, let's go to table and drugs and chemicals. The patient is pretty much having all of these problems or signs and symptoms due to her chemotherapy, which is her anti-neoplastic medication. So let's see. So we have anti-neoplastic. Let me make sure this is anti-neoplastic. And it's not really saying here that she was on any alkaloids or antibiotics. This is just general anti-neoplastic, and that's what that is for chemotherapy. And as you can see, as I was explaining, you have these several columns across the top. Like if she's gotten poisoned, this is pretty much up here explains the type of poisoning that the patient was, experienced. So if it was unintentional, self-harm, someone assaulted her, or it's undetermined. But since she's taking her medication, or they're giving her her medication according to instructions or as directed, and she had an adverse effect, we will code it from the adverse effect column. And so going over to the tabular, we have a little note, or you should have a table or a note explaining that you need to use your 7th digit character. So here's her initial encounter. If she was coming back for follow-up, then it would be a subsequent encounter. If this condition or dehydration or any other problems continue to persist because of this one incident, then it will be coded from the sequelae. So here is her initial encounter. So I have, poisoning by adverse effect of underdosing, no. Poisoning by intentional, no. Assault, no. Undetermined, no. So here we are. And as you can see, you can always go back to look at the 3 or 4 digit category. And so for her, she has T45.1X5. and then we have an A at the end. So this is pretty much how my code should look with my 7th character. So don't forget to use your 7th character when you're dealing with external causes of injuries. So now that we have that code, now we can look at the fact that the patient has cancer or a neoplasm. So this is my neoplasm table, and I'm just going to locate the organ of pancreas. He didn't give us details about exactly where on the pancreas the neoplasm appeared, so we're just going to generally code it as neoplasm primary because it's malignant. And then as you can see here, we have a 3-digit category for malignant neoplasm of pancreas. Use additional code to identify alcohol abuse and dependence. We was not given that information, so we don't code for that. Code also exocrine pancreatic insufficiency if the provider did mention that, but we could add this code because it's telling us that we need to add that because of the fact that the patient has pancreatic cancer. And then as you can see, these other codes just list the different portions of the pancreas organ, or the organ of the pancreas. So we're fine with choosing C25.9. I'm going to add that code. So now let me look at my summary. We should have dehydration, we should have adverse effect of anti-neoplasm, and we should have malignant neoplasm of the pancreas unspecified. This is how you should have answered your question 28 for your week 3 assignment. Okay, so let's move on and look at a few other things before we wrap up week 3, and then we're going to talk about what we are to look for in week 4. So the last and final case that I wanted to cover for week 3 is number 39. This one seems like it may be a little difficult. So let's see. Patient underwent a biopsy of the brain. The pathology report indicates secondary cancer from the primary site of the breast. The patient had a left mastectomy 5 years ago and currently receives no treatment for breast cancer. So here's an example where we were looking at the Neoplasm table and we had the various columns, primary, secondary, and in situ. So in this example, the patient has secondary cancer. The difference between primary and secondary cancer is the fact that the primary site will always and forever be considered the first or primary location that cancer has appeared in this patient's medical history. So any additional manifestations of cancer or cancer that appears anywhere else in the body will always be considered a secondary site. Even if now, as you can see, the patient has brain cancer at this point, if the cancer shows up on the pancreas will be considered secondary. The hand, the skin, anywhere else is secondary. We're going to always consider this patient having primary cancer of the breast. So how do we code this? Same way we did before. We're going to go to the Neoplasm table, and then we're going to go to the word brain, and of course you're going to see different portions of the brain, but it does not tell us exactly where on the brain the patient has cancer. So now we are going to just code for the brain, Neoplasm brain, and then we're going to code it as secondary. Okay, and then you're going to cross-reference that. Now that it's coded as secondary, we have to pay attention to the fact that the patient has a history, personal history of neoplasm breast. So here we're going to go to the word history, and then for history you have either family or personal. In her case, her history is personal. Then we're going to go down to malignant neoplasm, to the M's, and then breast. So as you can see, you're just going to kind of look at the first and second level of indentions under the word history, under the word malignant neoplasm. Under malignant neoplasm, your second order of indention under that would be breast. And then that's all you do. And you should find a Z code because history codes begin with Z in the ICD-10. The last thing we want to code is the fact that she had a mastectomy. Okay, so absent or absence. That's how you code when something has been removed. Then we go to the word breast. And then we got, it's acquired because it was done for surgery purpose. She wasn't necessarily born without breast. So we're going to say that it was absence, and then indented underneath absent or absence would be the word breast. And then you're going to see acquired, and you're going to also be given a Z code for that as well. So now that we've covered that, hopefully you guys have a better understanding of how to review these cases, and pretty much what you should do if you run into difficulty. Always check the back of your workbook to get the answers. And now we're going to see what we're looking forward to in week 4. So as usual, we start with our roadmap. Week 4 covers chapter 6 of the step-by-step. You're going to have your introduction that kind of talks about what you're going to learn this week and competencies and objectives. Remember, you always want to do as I instructed in the Getting Organized video, is to go through every week and download as much as you can into those folders for this particular course and these weeks, and work on them a little bit at a time. You don't need to do everything in one sitting, especially when you have a lot to complete. You want to do a little bit at a time, a little bit every day. Get the easiest assignments out of the way first, which are your discussions, your extra credit, and your keyboarding. Then go back and do your reading and make sure that you answer a couple of questions of your assignment and your test every day. And then come Thursday or Friday, sit for your regular test, your weekly test. If you don't score well, copy the test, copy the feedback because it's auto-graded, and then try it again. So for week 4 discussion, we will be covering how can medical-related TV series like House and Grey's Anatomy affect people who self-diagnose rather than visit a physician for a professional opinion. So you have some videos, you have some articles. So this is a very interesting topic next week. And as usual, you're going to have your test, your assignment. Your assignment, once again, coincides with the reading for chapter 6. And make sure that you reach out to me for questions or concerns as early in the week as possible. So that's pretty much everything I had for you guys today. Remember, we're wrapping up week 3. We have 2 weeks left in this class. You guys will be moving on to BC 2020, which covers CPT coding. I'm really excited for that. And then after that, it's 2030, which is a combination of both. Then you'll move on to 3020, which is pretty much coding on an advanced level. And 3030, if you are in the diploma program, will be your last course before graduation. 3020 and 3030 sort of mirror one another, so it's kind of like one full course, but they're in 5-week intervals. So here's my contact information, 805-824-0065, and thank you for viewing. Have a great week.